Hi, everyone. Welcome to episode number 6 of our series, Doctors' Aspects on Healthcare. Today, we're talking to a very special guest, Dr. J. First of all, thank you for taking time out of your busy schedule to be here today, and let's get started. So, how are you today?
I'm doing well. I'm good. It's a bit of a blizzard outside, so I'm happy today's my day off. How
Oh,
about
that's
yourself?
uh-huh. And would you like to tell our viewers a little bit about yourself and your specialty?
Sure. So my name is Dr. Lewars. I'm a new grad MD. So currently I'm awaiting match. Hopefully, results go in my favor. I'm pursuing internal medicine currently, and then subsequently I'll be going into interventional cardiology after that.
Yeah, that's amazing. Actually, my dream job is to also become a cardiologist. So,
Oh, really?
yeah, it's really cool that you're pursuing that. So, can you tell our viewers about where you're located and where you practice?
For sure. So right now I'm in Toronto, and again, just prepping for the match as it comes up, and we'll see where I end up within the rest of the year.
Hmm. And did you always want to become a doctor, or was there a particular moment that you realized that medicine is what you wanted to do?
I'd say when I was a preteen, around that time, that's where I realized that I was interested in medicine. I was really reinforced by my mom. She's a nurse, and she got me really interested in medicine, the whole aspect of it. But as I grew further, I saw different things happening in my community, things happening throughout my family that reinforced my own drive as to wanting to become a doctor. Specifically, there's an instance where my grandmother suffered a stroke, and I didn't really know how to help her out in that sense. I didn't know how to govern her care, and I was so young at the time as well. But I also noticed there was a lack of insight provided to her and our family, and I wanted to be an individual that could change that can actually find myself helping other people, providing insight, and really giving them information to govern and empower themselves in their care.
Yeah, that's so amazing that you figured out based on a personal story. And kind of talked about how you didn't really know too much, you didn't have too much insight about that. So leading to that, what is your opinion on the healthcare system in general in your region or in the world? And what are the major shortcomings and strengths according to you?
In terms of my access to healthcare, the type of healthcare that we face here, it's Canadian, so basically universal health coverage. So with regards to that, again, access is one of the biggest things. We are able to get primary care, ambulatory care. So that's the biggest forthcoming thing I'd say that is positive. In terms of shortcomings, though, with regards to the access, there's always delays.
Hmm.
So we may not be able to have everything readily available. And one of the other things is access to drug coverage. So we don't have universal drug coverage plans. So a lot of people are paying out of pocket for that. So that's one other issue. And then lastly, whether or not it's going to be financially stable in the long run, covering for so many people as the population grows. So that becomes a heightened concern over time.
Yeah, I definitely understand what you mean. And in that, do you think that everyone has access to healthcare? And are there being made changes being made to improve this?
So far, for the most part, yes. You won't go financially bankrupt or ruined from, a medical visit. So it doesn't hinder people from going to a walk-in clinic or seeing their PCP. So that's a real benefit. And again, you can walk into a hospital. Again, the ED might have a bit of a wait time, but you'll get seen, and you don't have to worry about, again, whether or not you have coverage to be able to see a doctor and get care. So access is, for the most part in my region, definitely there. It's definitely available as well.
Yeah, I'm what does the changes that are being made, what impact does it have on the situation?
So, in terms of changes on a governmental standpoint, from what I've heard, is that they're proposing plans for drug coverage. So, I think that's one of the big benefits because, again, if you have chronic comorbidities and you have to pay for medications chronically, it's hard to finance that unless you have a private insurance. And then, of course, with private insurance, if you have some underlying health condition, it's hard to be financed, right?
Yeah.
So that's one of the big things. So from what's being proposed, they're mentioning possibly incorporating a drug coverage plan.
Yeah, that's really great and insightful. Thank you for letting us know about that. So let's talk about the biggest predicament the world is facing right now, the COVID-19 pandemic. So how has the pandemic impacted you professionally in the workspace and personally?
So the pandemic is, I think, affected everyone greatly. For myself, on a personal standpoint, I think I've just valued life much more, communication, being able to reach out to my peers, my friends, just valuing that time to be with loved ones. I appreciate it much more. Of course, in a profession where work is very demanding and very time consuming, we often don't place much priority and time on extracurriculars or seeing family. And now when you have none of that, it's very taxing to not be able to access the ones you love. So that's one thing. In terms
Mhm.
of professionally, again, just really defined myself as an individual in terms of how I'm going about my profession. I would say that it's allowed me to be much more serious with regards to it, being
Mhm.
very vigilant with regards to the health comorbidities, chronic illness, and just watching its play in terms of the pandemic. So again, in being a individual that wants to be part of preventative care, right? That's what really heightens your awareness with regards to that, and knowing that it's so important that we take care of ourselves and our bodies. And then when pandemics like this happen to come up, then the individuals are better able to not be so susceptible and vulnerable to viruses and illness, just as this.
Yeah, that makes complete sense. And additionally, what do you think COVID-19 has had on access to healthcare?
It's definitely put a strain on access to healthcare. I mean, if we think about elective procedures and what we consider elective, things have vastly changed. I think in terms of access to healthcare as well, it's diminished it because in terms of the finances, there's lots of care clinics that are unable to be opened or shutting down because they can't see patients as readily as before, which again, everything has costs. We're hearing about hospitals shutting down, things along those lines.
Mhm.
But when we're thinking about access, we're also thinking about insurance, right? Especially in the States where much of the healthcare system is governed by private insurance or Medicaid, Medicare. For people that are losing their jobs, now they're not able to pay for such insurance premiums, or if they had any insurance that was associated with their employer or employer sponsored insurance, they're not able to have that. So if they happen to need to see a doctor, that care, that access to care is no longer there. So it's it's pretty much a whirlwind of things that come from again the financial standpoint of the country and everything along those lines. And
Mhm.
then now when you think about the increased demand for acute care as well, right? So individuals in these predicaments, especially with COVID-19, are going to be worrying about bills coming from their care to a certain degree. So I think that's really how it's impacted our system so far.
Yeah. And you mentioned about like bills and like financial like aspects of this. So do you think changes are being made specifically because of this pandemic and like in maybe financial aspects, or are there changes being made at all?
Well, from what the government says, from what we're able to hear, there's proposed changes so far in terms of health allocation, like resources allocation, right? So from the biggest standpoint, from what I can see, there's a willingness for that change, but of course, we don't really know exactly how the government's going to portray things, what's going to pass in particular aspects of government, right? So
Yeah.
there's proposed changes, but then we have to see them actually come into effect. So that's the big concern.
Yeah. And specifically in underprivileged areas, COVID-19 was remarkably severe. How do you think we can help them, or the people that have been affected by this, like another level? How do you think we can help them as a society?
Well, when we think about underprivileged or underserved, a lot of people think rural. But for
Mhm.
myself, I think inner city. I think of affordable housing complexes or communities. And I think of these places that are structurally designed to fail in times like this. I
Mhm.
mean, you're seeing locations that are not built with structurally foundational access to ventilation systems or AC or anything along those lines, or these locations may use public transport as the primary modality of movement. So we see in this aspect people are able to socially distance themselves, right? So that's a big hindrance in these underprivileged areas. Now we think about also food deserts, chronic illness, all these things that make people more susceptible to COVID-19, right? So when we look on a larger scale, it's for us to, and the government really, to invest in these communities to an aspect that better helps the housing structure, better public transport. We can think about telehealth as an option because at least individuals wouldn't have to travel towards these locations. Or from certain locations I've seen or hospitals, they do mobile clinics that go towards locations that minimizes the risk, gives a bit more control on the healthcare aspect. In terms of health initiatives, think about public health initiatives, free screenings. When I was actually back in Chicago sometime last year at the height of the pandemic, I did some volunteering, and that particular hospital, they actually did free screenings, so drive up screenings right from your car. They would do the COVID swab and everything from right there. So things like that really help. I think about also mental health, right? That's a thing that we don't really even play on too much or mention too much. And I think now that the pandemic has come out, people are speaking about that much more. And then, these underprivileged areas where people are already afflicted by a lot of issues with mental health, this has just impacted that even so much more. So, us being able to place more of a focus on mental health and wellness, I believe is something that's really going to help in the long run. And
Mhm.
then, additionally, health education, right? So, we're in a time where we have social media. So being able to present information to people that don't have to outsource or pay for regional conferences or anything like that. So that's one way for us to really help these underprivileged areas, again, aside from governmental funding and sourcing.
Yeah, thank you for letting us know about that. And similarly, to keep us safe, like, do you think the information we're receiving from like the media about COVID-19 is adequate enough? And is there any part of it you would like to like emphasize or exaggerate? Any important point that we could probably stay safe with that maybe other people aren't covering too much?
For sure. So I think the information is adequate. The problem is there's a lot of information and you don't know what's right and what's wrong. There's a lot of misinformation. And the biggest thing is knowing what source to go to for that information, right? So when we're thinking about, again, social media aspects, a lot of people will put something out that's sensational. And my advice is don't listen to the sensational headlines. Do your research, look at things that are scientifically based and find the rationale behind things before you jump to them. Also, not to politicize, the pandemic, in terms of how we're gonna go about following rules or following mandates in terms of, say, masking, right? These are things that have sort of plagued us even more than the pandemic because it's become an instance where information is now no longer trusted. So, with that said, even though the information is adequate, now we're not able to utilize it to its full capacity because we may not trust it, believe it, or even know how to use it.
Mhm. Yeah, that was super informative for us. And I've asked a lot of questions, but this is the last one. So,
Yes.
what are your views on the vaccine and what is the most efficient way to go about this?
So the vaccine, I believe, is a mainstay in us trying to minimize the effects of this pandemic and trying
Mhm.
to get back to some normalcy. I know people have their instances of distrust with regards to the vaccine. A lot of it also, I believe, comes again from the misinformation, but also the lack of information. People are likely to fear what they don't know, right? So it's also up to us to put out the information, even in a way that's easily accessible and understandable. But it's something that I believe is going to shape the way that this pandemic goes forward. Now, we don't know everything about the vaccines just yet. We don't know everything about even the virus itself, right? And in some time, we'll gain more insight as things go. But even as for my role, just trying to teach people about the inner workings of the vaccine, how it's going to help us. I think it's something that needs to be put on display for us all to see the benefit of it and to really start to trust the system. Just a quick thing with regards to the vaccine. So a lot of people don't know exactly how, especially the Moderna vaccine works. So pretty much it's not the virus that they're giving you. A lot of people have asked me on my social media platform, are they giving you the virus? Are you going to get COVID from it? And what it is, the mRNA vaccine, it's a it's based on a protein that is genetically able to be devised within the cells. So pretty much the vaccine's administered, right? And then the mRNA gives instructions to the body or the cells to start making a little protein similar to what's on COVID-19's, basically its cells. So the body starts making these harmless proteins. Then it puts it on the outer surface of the cells. The body recognizes the protein, and then it tries to actually build an antibody defense against it. So then once the body basically makes this antibody defense, now if it was to interact with a full-blown actual COVID virus, then it already has its defenses up versus an individual that has no vaccination, no exposure, receives this virus within themselves, and then it takes time for the antibodies to develop, and then it takes time for them to recover. So really, that's how the vaccine works. It's not that they give you the virus and then your body's working to fight off a version of the virus. It's just a little protein aspect of it. And again, there's a bit more detail to it. I think it's a bit more out of scope with things, but it's one of those things that we see that it's safe. It's not going to change your genetic code. It doesn't enter the nucleus, which is the genetic center for cells. And again, it's something that I believe is going to shape how we are able to fight this pandemic and get back to our normal lives.
Yeah, thank you for explaining it a lot clearer. I'm sure we probably learn a lot more because you explained how it exactly works. So thank you for that. And that is all we have for the interview today. Thank you so much, Dr. Lewars. It has been wonderful talking to you, and I'm sure everyone watching will have gained some valuable knowledge from this.
Likewise, thank you very much for the opportunity.
Yeah, thank you, everyone watching, and please stay safe.